Hello everyone, this is PHTV Channel 4 in Palos Heights. I'm Sue Jankowski and we are here with Meet with Moraine. This program we do every month and you get to meet all kinds of interesting people who are going to tell us about the programs at Moraine and get you involved in something. And today I think we have a really interesting topic for most people, young or old, and we have a guest here today, Kathy Wellman. Kathy, thanks for dropping by today.
Thank you for inviting me.
It's great. Kathy is the coordinator of the Therapeutic Massage Program. And I was just talking to Kathy a little bit before we started the program. I think everyone is interested in getting, a massage, whether it's therapeutic or for some other reason. But I can't wait to hear about what good comes of a therapeutic massage, because I know it does. And I was telling Kathy, I think we all regard, getting a massage as like a specialty treat, luxury item, and we don't do it. But there's a lot of reasons that we're going to find out today that it is good for you to think about doing it on maybe a regular basis. So I guess, first of all, let's start with what is therapeutic massage?
So therapeutic massage, if you think of the word therapy in therapeutic, people come to massage therapy for many reasons. Sometimes at first it's a reason because of pain. They have pain in their body, they have a condition, maybe they had surgery, they're rehabilitating something, and they're trying to get out of pain, and maybe they don't want to take pain medication all the time, or they want to diminish the pain medication that they're on. So they come into thinking massage will help them, and it absolutely does, because it will help facilitate and speed up the healing process. So people will come to it to reduce stress. People will come to it to work on a specific problem. Maybe they've been working a chronic repetitive type of job. Maybe they have 5 or 6 children, and the burdens of taking care of children and home just has put a lot of stress and tension in their body. So they will come in and say, well, maybe massage will help. And then after 1 or 2 sessions, they say, oh my gosh, why wasn't I doing this all along? Because it really has helped me.
Yeah, that's so true. And you're right, the repetitive activities that you might do with your job or with children or whatever it is certainly something that would benefit from this. And I think people go to therapy for their knees or hips or whatever, a specific thing. But this seems like it would be kind of an all over. Well, and I know there's specifics they can do to help you feel better. Okay, so in general, could you explain that therapeutic program at Moraine? Like, sure. What would your students be doing, and how would someone get involved in this?
So our program at Moraine Valley is 24 credit hours, okay, which gives the student an equivalent of a little over 600 contact hours, because the state of Illinois requires that you have sufficient training. And there are 9 classes at a minimum that the students will take, everything from introduction to massage therapy, pathology, anatomy, learning different techniques, sports massage, learning how to interact and develop an interaction and client basis with them.
Yeah, you have to have a little bit of a bedside manner,
yes,
because your hands
absolutely.
are all over this person, so that's a good thing to
we have
learn.
A class that's actually specific towards business and ethics, so we teach them not only about the business aspects of massage therapy and give them some information about the type of area they would like to go into, whether they want to work for themselves, whether they want to work for another place, a spa, chiropractic office, a wellness center, and then ethics. Ethics is, again, that bedside manner, but not just the bedside manner, but learning how to conduct a client therapy or a client and therapist relationship that's professional and that is beneficial to not only the practice that the student has or that the therapist has, but also for their continuing growth in the field.
Wow, okay, there's a lot of aspects there that you can go into, and I'm sure that there are, just that one area of sports, when you look at all the professional teams and so forth, I know that they probably have professional massage therapists there that go with the team. So this is a potential career plan that you could go into sports massage and
Absolutely.
do that with various teams or professionally,
yes,
with the professional teams or whatever.
Yes. And a lot of times a student, when they enter the program, maybe they're not really sure where they want to go with massage, but maybe they do have that interest in sports or spa, or maybe they want to work with a certain population of people, people that are sick or people that are a certain age, or rehabilitating, et cetera. So they kind of come in with a little bit of a notion of this is kind of what I'd like to do, and then the program just opens that door for them even more so that they can really expand upon, and we teach them a little bit of that throughout the entire program.
Okay, so when they get started, it's just a generalized courses, but then they can be more specific, or does it not really change based on what, whether it's a spa treatment or a sports treatment or therapeutic with older people or whatever?
That's a great question. So while we do have a class that is called sports massage, and interestingly enough, we have students who say, well, I don't want to do sports massage. I'm not interested in that deep tissue work. But the techniques that you learn in that class especially transfer over to any technique. So whether they're working, again, in a medical field, whether they're working in a spa, there are techniques that you learn to incorporate within a massage, whether it's on a very light touch, or maybe a little bit deeper touch for example, like the deep tissue work.
Okay, so when they're taking classes, so there's 9 classes, and some of that, depends on what it is. So there's a lot of classes that are like a hands-on kind of class. I mean, because that's what you're doing,
right.
So that's what you need to practice.
Correct.
Is this easy to transition into? I guess the question I'm wondering about is, I've had not a lot of massages over time, but some. And, they're so different. Each person has their own touch technique or whatever.
Absolutely.
And so how do you hone those skills for the way you're doing it, I guess?
So when the student starts, for example, in the first hands-on massage class, which is Introduction to Massage, they learn the basic touches of massage. They learn the basic strokes, and they learn to begin to incorporate those in a massage. So a little different, we have students that come in and say, oh, I love to do little massages on my spouse, my children, my mother, and they're doing it intuitively and just kind of helping the person. Mm-hmm. But then you learn a specific skill touch. And that skill touch is something that the student then continues to develop and hone throughout the program. So they learn it in the first class, they start to solidify it in the second class, and then in the successive classes, they're really fine-tuning it. They're really getting in touch with feeling versus just going through the motion. And that takes experience. So even when the student is done with our program and done with their clinical hours, they're still learning. But they are ready to begin doing that full-body Swedish massage with maybe adding a few modalities that they've learned and that they're continuing to practice and incorporate. But it really comes down to a skilled touch. And that actually takes many years to really develop.
I would think so. Just lots and lots and lots of experience to know.
Lots of different bodies.
And also you have person A wants this type of touch or feeling or whatever, and person B wants something entirely different. So you have to be sensitive to what that person may want. In fact, do you in this are the therapists encouraged to ask the person they're doing the massaging on, what do you want? Is this right?
Yes.
And are you happy with this? Or
yes.
However, whatever the questions are.
Yes, so we teach our students how to do that client interaction, how to take an intake with them, medical history, ask questions, find out what this particular client has going on, find out what their body is like right now, how strong are they, how healthy are they or not, and then to administer that touch accordingly. Because what's appropriate for you may not be appropriate for the next person, or that next person may really want a deeper touch because they are athletic and they are, conditioning their body, versus the person who's just looking to relieve stress, but fill out, help with some aches and pains that they have. So there's a lot of communication. We say this isn't the time to be quiet and just assume. You have to ask.
You have to ask, or just say that's too hard, or that's you can go deeper or whatever. Right. I would think that would help to get your client to talk, right. Which I don't know if we always do.
Well, and sometimes the clients don't want to talk. I get that, and we get that. But you have to ask them and give them that opportunity to say this is too much. And sometimes it's a matter of how you ask, versus saying how's the pressure. It's okay. Would you like more or less pressure? Oh, I would actually like a little bit less right now. Okay, let me modify that.
Oh, yeah, good
so
questions.
It's specific questions that we teach them how to ask.
Oh, that's good, because you don't know what you're asking for and need to do. Okay. So then if they're taking the ethics class, that's a classroom experience, and what's the format of that? Are there tests? I mean, how do we know? What are we doing in that class?
So we have, yes, there's homework assignments. Students actually do a lot of reading, and there's a lot of role play. So the students pair up with one another with little skits and scripts. A client comes in and does this or says this. How do you respond to that? And a client wants a certain type of massage, but you don't think it's appropriate for them because of their health. How do you explain that to them? So it's all role play that they do with each other.
Oh, that's great, because then they get almost a realistic experience with that. That's
Absolutely.
Great. Okay, so now the students come in. I would kind of guess that you get all ages of students who come in.
Yes.
Is that right?
That's correct. Yes, we have, and it kind of shifts a little bit over time. We have younger students who are interested in the profession, and maybe they're actually on their way to going into physical therapy or other medical fields or health-related fields, and this can be a stepping stone for them. We have students who kind of decide they're going to change careers, or adults that decide they're going to change careers. That was actually how I entered the field. And do a career change and enter the holistic health field. And then we actually have retirees that come in and take the program, sometimes retired nurses or retired medical practitioners who just want to step out of that field but yet still stay in the health field. And they have that experience of the years that they've put into the profession, and now they want to do this on a very small level, maybe even just for friends and family.
I would think those people particularly would be kind of good at that, I'm going to use patient-client relationship,
Oh,
because
absolutely.
they've got so much experience.
They've developed
dealing
that,
with
and they're
people.
comfortable working with people.
Yeah, so that's kind of a good thing. So, no one should be afraid to do this at any
Absolutely
age
not.
if that's what they want to do, or they've always thought about doing that. Would you say primarily this is more females, males? I mean, I'm guessing females, because that's what I see when I
Yes.
go to places.
The massage profession is still primarily female dominated, and I'd say between 75 and even 80%, although that is shifting. We are actually seeing in our program at Moraine Valley a lot more male students entering the profession, which is really exciting.
Yeah. Okay. Well, it's open to everybody. So
Absolutely.
if it's something, if you feel that calling, that's great. So someone starts in the program. How many semesters and how long from point A to point B? And I guess I have another question regarding that. Is, do they need to be get their 2-year Moraine Valley degree, that junior college degree, to do this, or is it just a certificate program?
Yes.
So they can go ahead and do that certificate and then go out and get a job?
Correct. So our program, state of Illinois requires you to have, again, a minimum number of hours, and that number is 600. Our program is a certificate program, so when the student graduates, and they can take it full-time or part-time, they can finish it in 3 full semesters if they are a full-time student, or they can take as long as they need to if they need to do it part-time. So let's say within about a year to a year and a half, they're able to complete the program, sit for their licensing exam in the state of Illinois, and then become a licensed therapist and be out there practicing. While it's not a full certificate program, the hours can be put towards a certificate program at Moraine Valley, because there are some classes that will be included in a certificate program, depending on what that student chooses. So some of them, if they are new to college, just graduating high school, and they want that associate's degree, they can actually use this towards an associate's degree as well.
Okay, that's great. So it's kind of dual use there.
Yes.
Would there be any difference? So if someone said, I really want sports or, spa or whatever, would there be some difference in the program? Or when they're going to look for a job, is that sports facility or spa facility or the chiropractor, are they looking for something in particular that they can get prepared for at Moraine?
So our program actually gives the student the information and the capabilities to be an entry-level massage therapist. And entry-level meaning they have all the minimum qualifications to work in any of those capacities. They can work in a spa, they can work in a franchise, they can work in a chiropractic office. They can start working in with sports conditions. And when you graduate from any program, students are required to continue their education with continuing education. So then the student who decides, I want to focus really more on sports or medical or rehab or spa, then they look for classes, continuing education classes, to hone in and really start to develop those skills while they're starting to work, and again, getting that experience, and then starting to really incorporate it and take off with it.
Okay, well, that's really great. I think what's really great too is first of all, there is an actual program, because you don't know when you're going into, a facility and you're getting a massage, what have been their qualifications, have they taken classes? So it is licensed by the state, and they have to meet certain requirements, so you can feel confident that if you're going there, they've had some education as far as that goes. And that's a really good thing. And then it's something that they've had a lot of experience in a classroom too, and I think that's really great too. So, we were talking also before the program about something that just opened up again that your program did offer earlier, and then of course with COVID, that was all kind of quieted down, and now this program is opening back up again. You explain to our viewers what that is.
Yes. So in the last semester of their program, students enter clinical hours, and our student clinic, our student massage clinic, is on campus at Moraine Valley, and it is currently open to the public again. Students perform 50-minute massages for $20, and that gives them the experience, obviously, to continue to practice and hone in on their skills. It's a full-body Swedish massage, 50 minutes, hands-on time, and the students actually run it as a clinic for themselves. I'm just there supervising for them. They actually learn how to do everything from start to finish with a massage therapy practice. So that again is open.
Going in, greeting your client, going through the whole 9 yards. Okay, so that is really actually hands-on experience.
It is very hands-on.
And what a great thing for people who want to give it a try or want to help out the students by going in and getting a massage. You can help them out.
Exactly. Help us. Let us help you. Help us.
Oh, right. So you can go in for $20 and get a massage and have that student have a chance to practice a little bit.
Right. And it's all supervised. I'm there on campus with them, and we have a wonderful amount of not only students and faculty that come in, but like I said, because we've reopened again to the public, our public is starting to come back in, and they really appreciate that opportunity, and they give us good feedback. So they give feedback to the students on how they're doing, so that they can continue to improve and to secure those skills.
That is really great, especially, for everybody, it's a great win-win. But for the students to know that they are practicing on people who are, coming in and willing to have that practice time, and then give them some good feedback so that they know, how did I do? Right. And you're not being critical, you're just you're trying to help them so they become better at that. Absolutely. Is there some sort of survey or something that they would fill out at the end?
Yes.
Okay.
Yes, a feedback form, and it's not just yes, no. We actually encourage them, please give them constructive feedback. Tell them what you liked, tell them what you maybe, thought they could do a little bit differently, or, maybe they wanted a different type of pressure, or whatever that feedback is. Let the student know, because otherwise the student assumes that they did great. And they did a great job, but maybe they could have done something a little bit different for this specific client.
Yes, and you don't know unless someone tells you, was that good or not? I don't know. You could practice on your friends and stuff, but they might not tell you exactly what you want to know either.
Exactly.
Yeah, your mom might not tell you.
Or they might tell you and tell you too much.
Well, that's true too. Yeah, exactly. What would you do? Call and say, I'd like to participate in this?
Yes, they can either call us or they can email us, massage clinic@morainevalley.edu, or they can call us at 708-608-4460 and ask to schedule an appointment.
Okay, and that's open starting?
It's open now.
Now,
yeah,
okay.
Until the beginning of May.
Are you finding that you have a lot of students coming in? Because I look out and I look at all these companies now, these franchise companies and spas and everything, and then we didn't have that 10 years ago.
Right.
So this has got to be a field that's just wide open for people to come in and have a career in this.
It is. With the pandemic the past 2 years, a lot of therapists actually left the profession. A lot of them decided, I'm going to start doing something different. So it actually opened up the windows for us. We are in demand and we need therapists. So our program is doing very well. Our student enrollment is increasing even through the pandemic because of the need. And again, there's a 32% growth rate in this field right now, which is unprecedented.
That's huge.
It's higher than most professions out there. So the demand is huge, and I get calls weekly from different places that need massage therapists.
Wow, okay, that's great news for people looking for something. If this fits your personality and this is something you want to do, it's such a great helping field. You know, if you're someone who really wants to help people, this is a nice way to do it, because you know, people, even if it's a relaxing, stress reducing, that's a great option. Or if you have really aches and pains, it really is so beneficial. Okay, so does the program like start like this starts in January, it's 9 weeks, or do you just jump in at any time? How does that work?
So we have a class that's actually called Introduction to Massage. It's 1 credit hour, 8 weeks long. We offer it twice every semester in the fall and the spring, and we do offer it in the summer. So sometimes students are not sure, or they just don't know if this is the field for them. They can take that course. Anybody can take that course, actually, even if they didn't want to go through our entire program. We've had, again, retired people taking the program, or taking the class, Introduction to Massage, because they just want to learn a little bit more to help family members out. So they can start that any semester. And then most of our other classes run spring and fall. And there's limited classes that run in the summer, but there are classes like anatomy that can be started in the summer. So really, the student can pretty much start any of those semesters, spring, summer, or fall.
Okay, and there's not a specific, you know, you have to take one class first, then this is the next class. There's no sequence
there
exactly?
There is a sequence, yes. There is some exchangeability within the sequence. So we do recommend that they meet with an academic advisor on campus to figure out what they need to take first. Some students take that introduction to massage first because the only requirement is that they be 18 years old. Some students say, I want to take anatomy first and get that out of the way, you know, and take the science courses first, so they may start with that. So you kind of have an option depending on when you start and what that looks like for you as far as taking classes.
Okay. And is there anything for people coming in that are requirements, like that they have to pass some sort of test? Or, I mean, I guess I'm wondering, is there a prerequisite for joining in?
Not necessarily in the sense of passing a test. As far as the physical capabilities, you do need to be able to stand at a massage table and, you know, do the massage work. Sometimes people think, I don't know if I could do deep tissue work. I don't know if I'm strong enough for that. And while you can definitely do deeper work, it's not about how strong you are. It's about your body mechanics at the table. If you're practicing proper body mechanics, you can do massages all day long.
That's good to know, because I always feel like, oh my gosh, how are they doing this with their hands and
right.
arms and well, just the standing all day, but also, you know, they're spending an hour or whatever, you know, could be more with you, and then they've got someone right after you.
Right.
So that seems like you would have to be strong, but you're saying because of the way you're learning how to do it, you can do it.
Yes. You know, you're delivering the strength through your arms and your shoulders. You're not using just your arms and your shoulders. We even tell our male therapists, you're much stronger than women. You have much more upper body strength, but you do not want to overwork your hands because, you know, you do risk having, you know, injuries to your hands or your wrists or your elbows. It has to come from your core. It has to come from your whole body. The only way you're going to actually feel what's going on in this person is if you use your whole body. If I'm just using my fingertips, I don't get that much information.
Oh, so interesting. So, I mean, there's a lot to learn, really, doing this. That is phenomenal. Is there anything else we need to know about your program? People can sign up anytime, you know, get ready. Let's see, we got summer coming up, so you could start then.
You can start there. We actually have another section starting after our spring break on March 21st. So if you really were interested, you could start taking Massage 101 in a couple of weeks.
Right there.
Or summer, absolutely.
Yeah. Well, and it's so great you can learn it just in Moraine Valley Community College, which is right next door. You know, it's just so close. You don't have to go far away or whatever, and then you've got a great career. And it's just such a great, helpful career. We'll put some of these things up on the screen for you, but I mean, there's a whole flyer on people who want to practice, and you can get a massage for $20 and help people out by, I mean, I can't imagine what they did before that when they didn't have anybody to practice on. The teachers.
Exactly.
Well, that's what my other question was going to be too, because really to know as the instructor, do you have them practice on you a little bit?
They do. They're very nervous to do so because we're the teachers.
Sure.
However, we do have little opportunities for them, and it is required at the end of certain classes that they give us some feedback, some massage, so we can give them feedback. Because even though I can watch them and give them tips and tricks, sometimes just feeling that touch and giving them some specific adjustments that they could do right then and there is really beneficial. And by the time they get into student clinic, yes, they are practicing on the instructors as well, because then again, we're able to give them feedback and give them information about, back in Massage 101, and now look at how much you've grown and look how much more confident you are in the work that you're doing. And they love that. They absolutely feel thrilled that, we see the growth, they feel the growth, and that just adds to, their overall experience.
Yeah, I mean, I would think you need to be the subject of, just so you know for sure. And, I'm sure they're very nervous about that too. But still, it's a good thing. Well, thank you so much for coming in today and sharing that. And again, this is a wonderful opportunity for you at any age, or your neighbor or grandchildren or children, to have an opportunity to go over to Moraine Valley Community College and become a massage therapist or any other aspect. There's so much going on over there. If you're doubtful, go in and see an academic advisor and talk to somebody there about what you can do, what you can learn, what's interesting to you. Maybe this is just right up your alley. It's a great field to be in. So thanks for being with us today.
Thank you very much. I appreciate it.
Yeah. Thanks for watching us. We'll see you next time on Meet with Moraine.